Hello everyone and welcome to NEET Mentor. PDCET counseling is going on and registration has started. The choice filling is also going on. In this video we will discuss like how to do the choice filling. What are the different factors you should consider while doing the choice filling. We will also talk about the seat increment and the seat has got revised, and after revision initially they had reduced the number of seat in comparison with last year, and now the seats are increased in comparison with last year. That comparison also we will see what are the different factors we should keep in mind. And in case you are looking for assistance in the choice filling, which is the most important part of the counseling, then you can take our package. There are multiple options. Just in 5,000 you can get the assistance for the choice filling, which will be customized based on your needs. Okay, and you will be able to access a portal throughout the counseling until the counseling goes on. Okay, for that you can contact us on this number 9319128677. Okay, what sort of features you can access there? Closing rank, as in the counseling going on for the round 1 also the closing rank will be updated. Seat matrix fee is going to be the same for all the institutes, but the stipend and bond is more important. You will be able to predict what sort of colleges in the government institute, public sector, PSUs, railway institutes, autonomous government institutes, out of those which institutes you are able to get in which state. Okay, so what are different factors which you should consider while doing the choice filling? Okay, the order of the choice filling, how you should arrange your colleges, because there are many institutes which you might not even heard about. Okay, so depending on how many beds are there. Okay, because there is a difference when the number of bed is 500 plus or less than 500. Okay, when you are going for the kind of like academic post after completion of PG. How much clinical exposure, if the patient load is good, okay, the patient footfall is good, but still you are not getting the clinical exposure, hands on is very less for the GRs, then also it's not a good option. Okay, but depending on your score and rank, how you should arrange the choices. Okay, how much stipend you are getting, does the institute provide hostel facility, OPD, IPD, depending on all those factors. And branch wise, if any surgical branch or kind of like radiology where you need particular devices, equipments, does it have, accordingly you should arrange the choices. Okay, so these are the different factors. In the government institutes there are district hospitals also, but how are those district hospitals? Should it be added before the private institutes or after the private institutes? How to mix and create a good to bad institute list, and accordingly you should arrange it. Okay, in comparison with the last year, 220 seats are added. Totally we have 2605 seats. In the government 65 seats are added, totally 533 seats this year. In private 2052 seats are there, 155 seats are added in private institutes. Okay, branch wise distribution, you can look at this analysis. There are seats added for emergency medicine also, around 50 seats are there for emergency medicine. Most number of seats are for anesthesia branch, 508 in 2025, then 508 just for private institutes and 99 in anesthesia for government. Then you have a good number of institutes for ops and gynae, 115 in government, 196 in private among all the institutes across India. Then good number of seat in pediatrics. In pediatrics you can see totally 320 in private and 94 in government. Okay, so lots of opportunities. Even you see last year the closing rank, based on the closing rank you can get an idea what sort of institutes you can get, but this year there will be positive shift. Okay, but it all depends like how you do the choice filling. In case you have reservation, So you need to know which institutes are reserved, having a reserved seat, and what is the bound status over there. Okay, so you can contact us for any kind of assistance. So that's all from my side. Thanks for watching. Have a nice day.